Kiwi Jenene Crossan has lost track of the days at North Shore Hospital. She has coronavirus. For her, that means a sore throat and what she describes as a heavy chest and hacking cough. She is case number 37. Jenene thinks she caught Covid-19 at a packed London Gatwick airport as she made her way home via Doha on Friday the 13th. The entrepreneur is aged in her 40s and she is in isolation. Medical staff tend to her in full personal protective equipment. Jenene did everything right when she landed in Auckland last Sunday with absolutely no symptoms. Her husband had left a car for her at the airport and she went straight into isolation. She spoke to me this afternoon via Skype video from her hospital bed in her isolation room at North Shore Hospital.
I'm tired and my chest is really heavy and I've got a pretty substantial cough. I'm less anxious than I was, which is probably a good thing. That's pretty much the extent of it. I don't have the fever that everybody else has talked about having. I've not really had that. And I started with having a sore throat.
So this is day what for you?
What day of the week is it now?
It's Saturday.
Thanks. I seem to have lost the week. We don't know exactly what day it is for me, but the DHB thinks that I probably contracted it on Friday, and we believe I probably got it at Gatwick Airport. And I was fine when I was travelling, and when I got home on Sunday, it was Sunday night when I started to feel bad, but I was already self-isolated. So,
when you say started to feel bad, what were the first signs that you weren't well?
You have to forgive me because my memory's not been very good all week, to be honest. I had a sore throat. I was getting a cough that was getting worse. I think actually, first of all, I had just really, really bad anxiety. I was quite remote in my isolation. We have a little hut. Batch is not the right word. It's a hut. It doesn't have any power or any water in the Coromandel, and I had taken myself there. And it's a 30-minute four-wheel drive track to get to. And I suddenly realised that if I was sick there, that I was actually going to be in trouble. So I was freaking out. So for the first day, I think we pretty much, talking to everyone over the phone, everyone was pretty convinced I was just anxious. And then the cough just got worse and worse and worse. So I came back to Auckland. Didn't touch a soul, didn't see a soul, and my husband hired a camper van. Still didn't touch him, see him, and he parked it in the driveway, and I got into that. Then I finally got hold of my GP practice. They came at me with hazmat suits, which was quite scary, and they did the swab. I still didn't see or touch anyone. And waited. It was probably 24 hours before I got a phone call from the DHB, and as soon as they rang, I knew I was damn it, I was toast. So, and that was. I've been here one night, and I was at home one night with it. So Thursday I found out. Yeah.
So how are they treating you, or what's been happening when you're in hospital?
Sorry, there's no one actually else in this room at all, and there's like 3 doors between us, so there's no chance of anyone getting my breathing, so I can't breathe right now. They are amazing. Everybody has been phenomenal. The staff obviously are full kitted out, and they try to avoid coming in, so they're taking all potential measures to protect themselves, as they should. And the kindness is wonderful. It's pretty scary.
Tell me about that.
Well, it's scary for everyone right now, isn't it? I know I'm going to be fine, but if this is how I feel for someone who's pretty fit and healthy, it scares me what other people who aren't as fit and healthy or who have compromised lungs or immunity, how it'll affect them. So I've been very vigilant about how I handle myself, but it's also the only reason I've shared all of this has been to just ensure that everyone takes it seriously. It's not just a bad flu. It's pretty bad.
Have you had the flu before?
Mm-hmm. Yeah, it's not fun. I watched my husband nearly die 5 years ago of pneumonia, and that was right up there as one of the worst things I've ever witnessed. And yeah, it's not a good thing. I certainly haven't got to the pneumonia stage before, but I used to get bronchitis a lot as a kid.
So have you seen your husband since you got off the plane?
Not within any distance. So when I got to the airport, he had driven a car to the airport for me. He met me at arrivals, but he was nowhere near me. He was like 5 meters away from me. We waved. I haven't seen him in 2 months, to put that in perspective. I cried my eyes out. I was pretty much looking forward to that homecoming. And he had packed the car for me, and then he took an Uber home. And then when I came back to Auckland, he has got the camper van sorted for me. And there's a cute Instagram photo on my Instagram of the kids waving outside the windows of the house going, "Hi, Nini," and me waving from afar.
You did a great job in terms of keeping yourself separate from other people.
Look, the only people I saw, and DHB knows every single part of it, is when I got off the plane and went to the Coromandel, and I didn't know I was sick. I went to Whitianga New World to get some food. I had a mask on. I had a hat, glasses. I wore full-length arms. I had gloves, and I hand sanitized myself. I picked up the things I needed myself. I packed them myself. I told the checkout lady to stay away from me. They must have thought I was absolutely nuts. And I had to, because I had no food. I had no way of being able to do what I need to do. At that stage, I didn't know I was even sick. I was just trying to isolate. And the only other one is coming home, I had to get petrol. And I did the same thing again. I did the full 9 yards, gloves, sanitizer. I sanitized the diesel pump after me. And then I waited until there was nobody in the petrol station at all. And then I yelled at the lady from afar, "Can you just pull up your thing and I'll come past and I'll tap and I'll run back out?" She looked very scared. But I did say to her, "That's why you need to have pay at pump," and kept going. But there's no chance. The DHB were very comfortable. There's just no chance that either of those people could have got anything from me.
You sound very clogged up, and I wonder, have you had to have help with breathing at any point?
No, not really. It's just I've got to the point where if I cough too much, I had vomit from coughing. I'm calling it the Covid-19 for over 40s because I peed myself doing it too. So that's less fun. But no, it's my chest. They've had a chest X-ray and it's currently clear. It's just all here, and of course the coughing is making my esophagus just raw. Yeah.
So, do they give you any medication?
I was on antibiotics when I had seen the doctor. First of all, for a swab, she gave me some because she was just conscious of some of the noise coming in one of my lobes of my lung. It won't do anything for the virus, but it might do for if I've got any other infection. Other than that, I am on Panadol and strepsils just to try and make my throat feel better. I'm a big fan of, I can't see them, the Lyphospheric vitamin C, Bliss Throw probiotics. And to be honest, I started taking some anti-anxiety medication just so that I could stop worrying about the world, because I'm sure we're all on that same boat right now of just feeling a bit freaked out.
So your husband and other friends, can they come and wave at you through your negative pressure room, or are you just talking to people on Skype and on the phone?
Yeah, mostly I'm messaging. I don't really have the energy to talk. So I've done a few calls with my mum and dad and family, but that's about it. My family are on lockdown. Even though they haven't seen me, we thought it was the best thing to do. So they'll be at home for at least 2 weeks. And, it's a good example of panic buying getting out of control. They can't get any food deliveries for another week. So everybody just needs to calm down. Just buy what you need, because the supermarkets can cope if we can actually just, level it out a bit.
If you're just joining us, we are speaking with Jenene Crossan, who arrived home from London via Doha last Sunday with no symptoms and went straight into self-isolation. Jenene later started to feel unwell with a sore throat and cough and tested positive for Covid-19. She says unlike some other cases, she has never had a fever. She's been in an isolation ward at North Shore Hospital since Thursday, where she's being treated with Panadol. Jenene went on to tell me via Skype that once she stops coughing, her 14 days of self-isolation will begin again.
It's fine. If that's what I have to do to keep people safe, then that's what I'll do. Not the end of the world.
So what
Sorry.
Are you okay?
Yeah, I'm fine.
So, I mean, how often does that happen? Is that a continuous on and off during the day, hacking like that?
Yeah, that's the worst part for me, is just the hack.
And at its worst, what was it? What were the symptoms you were displaying at its peak?
Well, I didn't get the fever that everybody else got. My temperature's been pretty normal. It's just it was sore throat. And then the sore throat, of course, has been made worse by coughing. And that's why my voice is as it is. It's really, the cough has been the worst part. Massive headache, but again, that's just probably from too much coughing. The cough is just when it really gets going, and that's nothing. On my knees for a few minutes gasping. So, but everybody's symptoms are different, and that's not about panicking people, because some people will have pretty much none. No such symptoms at all, is what I understand it. And then some people will have the high end, and I don't know where I fit within that. But I guess the message that my friend, Dr. Michelle Dickinson, she was being very kind to call and make sure that, I've got all the intel and know where things are at, is people need to remember that you can't judge how healthy somebody is as to whether you spend time with them or you hug them or they shake their hands, because nobody knows. I was so painful. I don't know if I was the one sick. It could have been them. I don't know. I was pretty angry at Gatwick Airport, and I sent off a number of messages at the time, and I stomped around the airport trying to find management to yell at them for not a single frontline person had hand sanitizer, and they were just touching person after person after person, and it made me feel sick. And I think that's where I got sick, to be honest.
Yeah, and why do you think it was Gatwick? Why have you pinpointed it back to Gatwick?
Because it was a cesspool. I walked around Virgin, Emirates, Qatar, British Airways, can't remember the names of the rest of them, but all of the frontline counters, and I asked every single one of the staff members, because I'd seen it for myself with Qatar, and they had no hand sanitizers, had nothing. And these people were touching everybody's documents, everybody's bags. And you're going into the lounge, you're seeing the same thing. And when I got onto the plane, the Qatar people, for the first flight, because it was obviously 2 flights home, they told me that they weren't allowed to wear gloves or masks or anything, because that they had been told at that stage by the airline that wasn't the right thing to do. I was horrified. It was unbelievable. I'm sure all that's changed now. They were too busy trying to charge me £1,500 for one extra bag, because I had to bring all my luggage home from London because I'd been up there for a long time. And I was like, you know what? You charge me what you like. Can you just go get some hand sanitizer for your team, please? That's what's more important. And they just looked at me like I was crazy.
Do you feel like you've turned a corner in terms of your health and the road to recovery?
I feel better than I did a couple of days ago, but I need to make sure I sleep more and let my immune system do what it needs to do right now. So that's the focus.
Really appreciate you speaking to us. And obviously it is an unusual thing to hear from someone who has COVID-19. Would you like to say anything to people out there about, you obviously did all the things right. You kept separated from people. You took it seriously. What would you like people to know?
Um, yeah, look, it's obviously it's a hard thing to go public with it. I certainly didn't expect to make a breaking news story on it. And I just wanted to reassure my panicked friends because, I'm on social media like everybody else and just seeing everybody freak out. And it is going to get better. And one of the first messages I shared earlier in the week was China's starting to go back to work now. The hospitals that they set up have been closed down. Orders are coming back in for China. So, things will get better. In the industry that I work within, which is the hair and beauty industry, I'm going to call it the regrowth because we're all going to come back out of this. And there's going to be some seriously bad hair needing to taken care of. So it will get better, and it's going to be scary for a while, but it's not the apocalypse, and we just need to look after the people around us and be vigilant and not be casual about it. It's not the time to go out and go partying. And as much as I love support local, support them do other things, support them do deliveries, help the government help you, and they're putting together great packages, make the most of them, hunker down, learn to play Scrabble.
And the oldies, stay away from them?
Yeah, absolutely. Like I'm like everybody else, I'm worried about my businesses, I'm worried about my parents, I'm worried about my family, all of that stuff. But, we just have to do everything we can to protect them. So if you're listening, Dad, stop going to work. So.
Oh, well, you haven't lost your sense of humour, Jenene.
No, it never goes away. Yeah, so, and please stop beating up on the people who have got it because they didn't ask for it, they didn't want it, and hopefully others can follow the kind of example I'm trying to lead, which is just really be vigilant. That's it.
Thank you so much. I really appreciate you talking to us, especially from your hospital bed. I know it's probably been an incredibly stressful time, and I think it's helpful for people to hear and see what a case could mean, although everybody's going to have different symptoms, as you say, and different severity, So I thank you so much. Really do appreciate it.
Thanks for the visit. You've been the only one I've had all day.
Well, we wish you well, and I'm sure you're being looked after well, and we would love to check in on you maybe in a few days' time and just see how you're going and if you're close to getting out of there.
One last thing that I'd just like to say, and that is I don't care about anybody's politics. Now is the time to say thank you to Jacinda for her extraordinary work she is doing. I have no idea how she's doing it under the pressure she is, but what a bloody great leader she is, and we are very lucky to have her. So keep up the good work, Jacinda.
And that's Jenene Crossan, New Zealand's 37th COVID-19 patient, speaking to us via Skype from her isolation room at North Shore Hospital. Now, if you want to watch that interview back, you can see it on the RNZ website and our Checkpoint Facebook page.